What is achalasia? Achalasia is a rare disorder that affects the motility of the esophagus, the muscular tube responsible for moving food from the mouth to the stomach. The defining features are the lower esophageal sphincter, LES for short, fails to relax properly. The esophagus loses its coordinated muscle contractions, known as peristalsis. This combination causes food to stall or back up, often painfully, and can dramatically alter how someone eats and lives. Most medical literature outlines classic symptoms that include dysphagia, difficulty swallowing solids and liquids; regurgitation, undigested food or saliva returns to the mouth; chest pain, especially near the sternum or diaphragm; heartburn, hiccups, and belching; nighttime coughing or aspiration; weight loss, fatigue, and nutritional deficits; and the need for liquids to push food down the esophagus. Experts aren't sure why achalasia happens, but possible causes are genetics, it may be passed down from your parents, autoimmune problems, a viral infection, or a loss of nerve function, neurodegenerative. Epiphrenic diverticulum, a pouch that forms in the esophagus, can result from achalasia and forms due to esophageal motility loss. Another similar disorder that's sometimes confused with achalasia is called dysphagia. Dysphagia has some similarities, but its causes vary from those of achalasia. It has all the fun of difficulty swallowing food but doesn't generally block liquids. While the root cause of achalasia remains unclear, it's believed to be related to degeneration of nerve cells in the esophageal wall. Diagnosis typically involves esophageal manometry, the gold standard. Barium swallow studies often show a bird beak narrowing. Upper endoscopy to exclude cancer or inflammation. Treatment options. Unfortunately, there's no permanent cure, but multiple strategies offer symptom relief. Botox injections can temporarily relax the LES, but often require repeat treatments. Medications like nitrates or calcium blockers offer limited success, but can help. Balloon dilation expands the LES with a balloon, but there's a risk of perforation. Heller myotomy, or surgical cutting of the LES muscle, is often combined with anti-reflux surgery. POEM, an endoscopic version of myotomy, can offer relief and is less invasive. Esophagectomy, or removal of esophagus, is a rare option reserved for severe or cancerous cases. Prognosis. With treatment, many people experience long-term improvement, though ongoing care is essential. Life expectancy is generally unaffected if managed well, though complications like GERD or esophageal cancer require monitoring. Now it's my turn to share. My experience with achalasia began when I was 17. I was visiting a friend who offered me a hot dog, something simple, just so I wouldn't feel left out. I took a bite and spent nearly an hour trying to swallow it. That night, I felt a mild pain near my diaphragm, and honestly, it never quite went away. As the years went by, I started noticing a pattern. Whenever I ate solid foods like beef, chicken, or pork, that same struggle would return. Bread had its moments too, though less predictably. What kept me functioning was improvising. I found that I could get the food down if I flooded it with large amounts of liquid. It became my workaround and my routine. Just get the first bite down, then flood it with water and hope for the best. After that, things usually felt normal. Fast forward to the past couple of years, I'm 53 now, and everything's escalated. Achalasia isn't something I can sidestep anymore. Every single time I eat, I have to clear the blockage. Sometimes water works. Other times I end up bringing the food back up. And that part's the worst. It's not vomiting exactly because the food never even made it to my stomach. But the physical strain is real. It's painful, gross, humiliating, and fills my eyes with tears. Not from crying, my eyes just start watering heavily. And every time it happens, it chips away at the simple joy of sitting down to eat. I rarely eat out anywhere now. This is the part no one tells you about. The rituals you build just to function. The unpredictability of what will pass and what won't. The emotional weight of public meals. And taking longer to eat, methodically, carefully. Achalasia doesn't just affect my esophagus. It affects how I feel around other people, how spontaneous I can be, and how much I dread the next bite. I wrote this to increase awareness. Achalasia is often brushed off as trouble swallowing or indigestion, but that barely scratches the surface. It's a lifelong negotiation with food, with embarrassment, and with control. Raising awareness starts with telling stories like mine. If you're living with achalasia or suspect something's not quite right, you're not alone. And you shouldn't have to navigate it in silence. Bring it up at your next doctor's appointment and decide what you want to do next from a more informed perspective. Take care of yourselves and stay curious.